Um, for those that may not are able to join us for this afternoon. And before I begin, I'd like to extend a big thanks to our clinical community for supporting our student learners, including the ones that may struggle while they're on placement. And so our hope uh, with today's session is to provide an overview of a struggling student, starting with what is a struggling student. So we'll give some context to what we mean by a student who is struggling, followed by signs that clinicians can be aware of that a student may be struggling or going toward that direction, and understanding different perspectives, not only of the student, but the clinical instructor and also the university. Um, being aware of some of the attributes of both the student and clinical instructor that enable success of students while on placement. And finally, just a brief overview of some of the steps that clinicians can take toward navigating a student that may be requiring additional support while on placement. Um, so our hope is that after this session that you'd recognize some of the factors that contribute to a student that is struggling while on placement, and just some more awareness of the strategies that are available to you as a clinical supervisor to navigate a student that may require additional support. If you have any questions, I just ask that you feel free to raise a hand, um, or you can just intervene. We're a fairly small group, so feel free to intervene at any time, or you can save your questions to the end. So a struggling student is usually a term that we give when a student isn't meeting the expectations that are set out by the student, and that may be from the perspective of the student themselves. So we, as in the coordinators of clinical education, sometimes will be contacted by the student who doesn't feel like they're meeting uh, the expectations, or they're not doing well in a placement. Some students lack self-awareness, but occasionally we are contacted by the student with some concerns of their own performance. Other times it's the clinical instructor that will reach out with some concerns around the student's performance to date. And it's also maybe the coordinators of clinical education ourselves that may be reaching out to the supervisor in advance of a placement if there's already been concerns addressed in the academic term preceding the placement. The key that we've have come to know and that works best is early identification. If we know a student isn't performing well or requiring additional support, is identifying early, having a plan in place, an intervention always leads to better outcomes. Having notification at the end of the placement or after a placement has completed doesn't give us much opportunity to address those with the student. So we encourage early identification. Some of the signs that a student may be struggling that we often hear from clinicians is often a lack of engagement, enthusiasm, motivation, or just a lack of interest in the placement. There may be some avoidance behaviors in not demonstrating or achieving required skills or demonstrating a certain level of knowledge. They may be poorly organized, not preparing for uh, the client interaction. They may not be following instructions. They may not demonstrate sufficient skills in analyzing or problem solving, or that process of applying what they learned in the academic term to translating that to clinical practice. Typically, and probably more commonly, we'll often hear some professional behavior concerns around time management. If the student is showing up late, continuously on a consistent uh, pattern, poor communication skills, lack of an awareness or their own ability to self-evaluate. And in my personal experience, the student that I have the most challenge with are the ones that lack the ability to self-aware, the ones that don't know what they don't know, and that can be challenging. One of the things that we can do is just understand the different perspectives and all the stakeholders in a placement, and the first one being the student, of course, and getting an understanding of what they believe their role and expectations are while on placement. Um, as one of the coordinators for placement, we hold regular prep sessions prior to students um, going to placement. And so I feel like we do a pretty good job of this. But sometimes students still feel that their role really is less participatory and more observational, which we would discourage. In other words, we want them to be active participants and active learners. Um, and but maybe it's a comfort level that they're there to observe and not ask questions. And certainly we would want to address that if that came up. More commonly, other potential reasons are often undisclosed health issues or personal circumstances or anxiety that may be in the background that we're not aware of. And they may come forward if if the student is approached, and certainly if these are um, present prior to the placement, we encourage students to seek help, and we provide them with resources and services that are available on campus, such as the student accessibility services. We encourage them to contact them early. If there are accommodations that are required for placement, then they can help work with the student and the coordinators for clinical education to formalize those. So then we can present those in advance of the placement so everyone is aware that um, additional support may be required. I think I would be remiss if we didn't also consider the perspectives of the supervising therapists and their belief system. Some of these examples sound like somebody who may be old school and well, I did it with less support, so why shouldn't they? Or students learn best by watching and not doing. And I don't really come across that too often recently, but if that exists, then certainly we would want to clarify that, we don't want our students to observe. They're meant to participate, and simply our students can achieve the competencies that are expected of them if they're observing for the placement. Um, but certainly additional reasons for um, reasons that may impact performance may be their own undisclosed health issues or personal circumstances. They're only human as well. And we often hear too of caseload demands at work, and the idea of having a student and potentially a student with additional support is putting undue pressure and burden on them and their patient care. And we certainly get that. Or they may not be prepared for student supervision. And so these are some of the potential reasons that may lead to or impact a student's placement, for sure. Certainly from the side of the university, as I said, we have prep sessions that are organized through the academic term preceding the placement, where we communicate the leveled expectations for the student at that point in their learning. We do encourage active learning, and again, we've even redesigned on the physiotherapy side, and I know occupational therapy does this as well, where the students are more involved in their learning and navigating and managing their learning experiences. And one example of that is a learning contract that we have students develop prior to going on placement. And we ask that they show up on the first day of placement with a set of learning goals, recognizing that, they may not be familiar with the environment or the setting or area of practice. But after a week of being submersed in the culture and the environment, they can tweak those goals and have a conversation with their supervising therapist at the end of the week to see whether or not they're reasonable. And that sort of give and take helps to close the gap of expectations if one exists. We encourage that students take responsibility, and those responsibilities certainly would be expected to increase as they become more senior, as they move through their program. Set up learning experiences. So we encourage students when on placement to take advantage of all learning opportunities that may exist while on placement. And that may be, shadowing another therapist or another health professional. Certainly, if a student is struggling with the area that they're in, it may be wise just to keep them in that area and have as much time as possible. But that could be a discussion with the supervisor and the student. If there's certain tools that the therapist uses, or if it's a very specific area of practice or setting where certain tools are used more often than not, that could be something that could be communicated to the student prior to coming to the placement. So when students send out their introductory letter, um, we often will have the students ask if there are any resources that they could review in preparation for the placement. That would be a good opportunity to have the student come to placement prepared with those tools in mind. And we want our students to ask an appropriate an appropriate amount of questions, not overburdening our clinicians with too many questions, but questions that help to stimulate clinical reasoning. Of course, we want our students to look up things as well. And that's why I said an appropriate amount of questions. We don't need to spoon feed them. We want and we would expect students to make mistakes, provided they're not jeopardizing patient safety or care. And I think, when mistakes are made, certainly I think learning occurs in that. I don't think we expect our students to get it perfect every time, and that's okay, as long as they learn from those. And I think having an opportunity to debrief from those areas and talk about how in the future, if something like this occurs, how can they mitigate it if it happens to occur again. Some of the attributes that we've heard, um, attributes of students that enable success that we've heard from clinicians are the ones that are, they have this ability to accept feedback, constructive feedback, and apply it. So instead of getting defensive, they're open to it, and in fact, they actively seek feedback, and they turn around and apply it. So that immediate um, um, acknowledgement of the feedback given by their supervisor. They're active learners, as I said before, taking charge of their own learning. I've had some students when we've had downtime between patients, they've taken advantage of a lot of that downtime to seek clarification in some of their skills or things that they struggled with before. And I've had other students that just had downtime. They didn't do any of that. So the ones that impressed me were the ones that, they had an agenda and they were taking full advantage of those opportunities when they arose. They had an action plan and expectations were clear. Their communication was clear and concise. And they had this growth mindset. They were very resilient, adaptable, accountable, and they had this ability to self-assess and self-awareness, as I said. Some of the attributes that enable success among clinicians and supervising therapists that we've heard from students are that they are supportive, they're compassionate, caring, empathetic, understanding. They had this positive regard. They were quite enthusiastic to have students, and this sort of desire to share and teach. Um, they would often do this, supervise a student for the love of educating and passing on what they have learned, rather than they had to because their organization was forcing them to. Um, if any issues arose, they were quick to identify it in a proactive way, in a supportive way. They may reach out to other colleagues, or the center coordinators at their organization to maybe talk about things that have come up, or they may even reach out to one of the academic coordinators for clinical education at the university, like myself or Catherine, who's also attending this session. So they may reach out to us just to pick our brain about a situation that's arose, and certainly we would encourage um, you to do that. It doesn't necessarily mean that we're going to automatically reach out to the student, and we can have those discussions on how to proceed when depending on the issues that have been raised. The supervisor's also adaptable, specifically around their teaching methods. Sometimes the way we teach doesn't always align with, um, the learning style of the student. Um, and they're effective communicators. The expectations for the student is clearly laid out, and there's regular check-ins and regular feedback, good and bad. And I think that's um, been helpful for students. And the last part of these slides, we're just laying out a very superficial um, pathway to supporting students that may be struggling, starting with gathering the data, reflecting on your teaching styles, discussing concerns with the student, perhaps involving the educational program, and designing the intervention plan, and maintaining a written record. So starting with gathering the data, and again, this may be starting with some of the signs that a student may be struggling that we saw in the first slide. So what those issues may be, and then validating it. And that may be reaching out to a colleague or perhaps even patients, however that information is presented. Is it me or am I just imagining this? What are your thoughts? And so there's an idea of getting the context and then also validating that information. I think it's important that these issues that are raised also appear on the student evaluations. Um, I sometimes where we run into problems is where some of these issues have been raised, but then when we go to the clinician's evaluation of the student, there's no concordance. It looks glowing, and it would be hard if at the end of the placement, if the student received a fail or a recommended grade of fail, and yet the evaluation doesn't reflect some of those concerns. So if they are recorded on the evaluation, and again early, and with in the physiotherapy program, we moved away from sort of the 2 points of evaluation, the midterm and final, to smaller, more frequent evaluations. And so if those are documented early, with examples of some of these, without obviously divulging any patient-sensitive information, certainly will give context to some of the issues that are being raised. And I think we need to also consider some of the internal and external factors that we spoke about, that certainly can impact a student's performance, and it does and will give context to the situation depending on what that may be. We had mentioned before about reflecting on your teaching style and how that may not always be in sync with the learning style of the student. I used to start placements with students by asking them, what's your preference for learning? How do you learn best? If they knew that, I would often say, my approach to teaching on placement is I like to, maybe it's I like to quiz students, or I typically will quiz students in front of patients. Do you feel comfortable with that? And if not, we can do that sort of in the privacy when a patient is not there. So sometimes I would open with that uh, if there's during the orientation to get a sense of if the student had any preference, recognizing that not everybody likes to be quizzed and they learn differently. And certainly when I was a student um, at Queen's and going through my placements, there was all sorts of different teaching styles. Some I liked, some maybe I didn't like so much, but that's just part of it. Um, the other the other thing to consider is this discrepancy in expectations. And so when issues are often raised, we can certainly identify where there wasn't the expectations weren't clearly understood by one of the parties or all of the parties. I think the learning contract could be the beginning of that to sort of set those expectations out to the student. It's hard for us from a university to say what they're going to be doing on placement, because there's lots of variations for different clinical sites and settings and areas of practice. But the earlier that conversation happens, the better. So if there's any gaps, identifying those. I think also, whether the clinician has sufficient time in their schedule to support a student. And I know we're always, it seems to be in desperate need of placements, and maybe sometimes we coerce people into taking students. Um, but certainly when a student is struggling or requires additional support, that can also have an impact on the clinician as well, as we said before, in terms of their caseload and their expectations in patient care. Personality conflict is also, I think it's common. We certainly don't get along with everyone, and that goes along with students. We may not always get along with our student. We have a personality conflict, and we just clash, and that can be a source of friction and can certainly impact the placement. Um, And I think, so at that point, we can explore other options and um, whether other colleagues can help or the center coordinator at your organization. And of course, we would encourage you to reach out to us if we need to navigate some of those situations. As I said before, raising the issues with a student early, I think, is been very valuable. Giving them an opportunity to identify sort of some of the issues that have been raised and have been validated, taking the time to discuss this with the student, get their insight and their take on these issues. Hopefully working together to develop a better understanding of the situation and perhaps developing a plan forward to mitigate these issues. Sometimes that can occur smoothly or sometimes not. And that may be where you need to reach out to someone else for help, including us at the university if you need some assistance with that. I think, again, addressing these concerns early, it gives the student an opportunity to acknowledge this and also to give them time to make effective change. In other words, at the end of the placement, I used to hate hearing some of these things at final because there wasn't anything that we could do or the student to do, in all fairness. And even sometimes midterm, in our older tool that we use, the ACP, midterm was about the halfway mark of a 6-week placement, so third or fourth week. That didn't leave a lot of time for the student to be able to make effective change and demonstrate that they were able to remediate those issues. So certainly, again, earlier it's identified, the better the outcomes. And I'll just reiterate, certainly that we are here, not only on the behalf of the student, but also for clinicians. If there are any identified weaknesses or areas where the student has struggled, perhaps on a preceding academic term, we would divulge that to clinicians prior to the placement if we felt it was significant enough. We weren't able to do that prior to a number of years ago, but we have since have had students sign a waiver to say that we can share that information. I think it was perceived in the past as being punitive, but I think the mindset is, and how it's been received since the policy has changed, is clinicians have appreciated that. In other words, prior to the placement starting, if I said, I have this student who has been permitted to go forward for placement, but there's been a few things where they've struggled with in the academic term, specifically these areas. Do you feel that you're able to take on the student? And it gives the clinician insight into the student. So we're not blindsiding the clinician and downloading some of the areas that the student needs to now suddenly on the clinician. And most clinicians have said this has been helpful because they can adapt or tweak their schedule to accommodate some of those learning needs. It also gives the opportunity to the clinician, if they can't at that particular time supervise a student, um, an opportunity to withdraw from the placement. So that policy has been effective. If we haven't contacted a clinician in advance of this, then these are issues likely that haven't come up on placement before. And just because you reach out to one of the coordinators for clinical education with regards to a student doesn't automatically mean that we're going to reach out to the student. And I'll have a conversation with the clinician and to say, how would you prefer handling this? And some clinicians may be, you know what, I feel like I'm good. I just wanted to pick your brain and get some of your thoughts. Others feel more comfortable maybe with us intervening or even sitting down with a student, or all three of us sitting down to develop and execute a plan moving forward. And it's really situation dependent and student dependent. And certainly during those meetings, we would clarify expectations, and of course with the student, the consequences if they don't meet some of those expectations, what those are, if they are unclear. And so when we talk about an intervention plan, we're really looking at clarifying what are the issues and what are the outcomes that are going to be used to measure whether or not the student has achieved those outcomes, which I think is important. And so we'd be very detailed in outlining specific activities as well as timelines. That can often be done through a learning contract, and that learning contract is a living document. So certainly that is a tool that the student can use to make very specific goals and a plan to achieve and address some of these issues. So how is the outcome going to be evaluated and documented, and the consequences if the outcomes aren't met, as I said before. And again, usually in the intervention plan, certainly we would also make available to the student the resources available to them, whether it's us as the academic coordinators, another faculty member perhaps, or some of the other support systems through the university, like student accessibility services. The other thing that we also will um, do as part of this process is document all of the steps, and have a written record, including the data that has been presented in terms of the issues raised, perceptions, expectations, assumptions, um, with specific dates, um, perhaps the impact, whether it be on the supervisor or the student, the patients, placement objectives. The intervention plan is clearly laid out, and the outcome. And so that written record, we often will email back to the student for them to typically review. And we ask that they acknowledge that, back in an email, to that they understand, or if they have points of clarification, that we have a written record of that. And sometimes that written record will be part of the student file, just for our records, in case there's any issues that happen on a subsequent academic term or subsequent placement. So that's the concludes the brief overview that I've put together in terms of struggling student. Did anyone have anything else to add, maybe that wasn't included as part of this presentation, or any of your own experiences with students requiring additional support? Um, well, that's okay if you didn't, or if you don't want to share, that's fine. I'm going to stop recording.